Today, 20 doctors serve in Congress. One has made it a point to go on the Senate floor every month and make at least one speech about Obamacare. Every month he offers what he calls his second opinion about what should be done about American health care. That senator is Wyoming's John Barrasso. Welcome to New York.
Thanks for having me.
Why do you do this? What's wrong with Obamacare?
Well, it's a 2,700-page bill.
Yeah, I have it here. It's very
I
heavy.
think it's bad for patients, bad for providers, the doctors and nurses taking care of those patients, and terrible for the taxpayers. The problem with this bill is 1,700 times in the bill it says that the Secretary of Health and Human Services will come out with rules and regulations.
Which means even more than
probably
this.
100,000 pages. So I keep going to the Senate floor because there are ongoing unintended consequences that the American people today, more of them are opposed to the law than the day it was signed, and a lot of them were against it back then too.
All right, let's say we repeal it. There, we repealed Obamacare. Some people don't get care. There are problems in health care. What's your answer?
There are problems in health care, and we can do better. We can let people buy insurance across state lines. They can't do that now. People that get their insurance through work end up having a tax break through work, but if you have to buy your insurance personally...
Let's do them one at a time. Across state lines. Weirdly, every state has its own regulations. That's fine. But I'm not allowed to buy from a state that has more reasonable regulations.
You should be allowed to shop around. You know, when you call 1-800 number and you can find out about car insurance, you ought to be able to do that about health insurance. Find out what is best for you and your family and not be constrained. Plus, you'd have more competition. I think that would drive down the cost of insurance.
All right, your second point is?
Well, that people who get their insurance through work, that's treated separately and differently from a tax standpoint as people who buy their health insurance personally.
At work, you get a tax deduction. Personally, you don't.
You don't. So you end up actually paying a lot more in after-tax money. I think those people ought to be treated the same. So if you buy your insurance personally for you and your family, that you ought to get the same tax situation as the big companies get.
So either I get the tax break or get rid of the tax break for both of them.
Either way, it ought to be fair.
Why do we buy it at work anyway? I don't get my clothes or food from work.
World War II, there were price freezes in the country. They couldn't give people raises, so they said, well, tell you what, we'll let you get health insurance and you let your company write it off. And that has stayed with us now all the way since World War II. That's why you get it at work.
Because people on average now change jobs every 4 years in America. Some people won't quit their job. I don't want to lose my health insurance.
Yeah, you would rather that people owned their health insurance personally. They own their car insurance, they do other things that way. Their health insurance ought to be treated the same way.
And if it were taxed fairly the same, people would do that. They'd say, I don't care what my employer covers, or maybe I'll take his, but I'd have a choice.
And they'd buy what works best for them and their family and their own personal situation.
All right, another point of Obamacare that even Republicans say, oh, I want to keep this. Bill O'Reilly says this to me. I think he's wrong, and I think you do too, is there are anti-discrimination rules. And they sound good to people. We don't want insurance companies discriminating against me or sick people. That sounds fair. And many Republicans say, get rid of Obamacare, but keep these anti-discrimination rules. What's wrong with that?
Well, the way that they have this set up, you cannot give incentives to people who stay healthy, who monitor their health, who get their weight down, they get their diabetes under control. You cannot take advantage of the incentive, so you can't give somebody an incentive to try to stay healthy. There's $10 billion in this Obamacare health care law for jungle gyms and street lamps and pathways, but nothing to give you an incentive to get off of the couch and put the Cheetos or potato chips away and actually go out and walk or exercise.
So it is legal to discriminate against smokers in the law. So an insurance company could charge President Obama more as a smoker than if he quit. But it can't charge him less than Chris Christie for being presumably more fit.
They cannot give the incentives that we need. So some young person, 22 years old, who goes to the gym every day of the week, perfectly fit, is, I believe, being discriminated against in terms of what they're going to have to pay.
So this is one of the useful parts about insurance companies, that they're forbidden now to exercise under Obamacare. But isn't part of the problem of Obamacare and all this discussion, they're talking about coverage rather than care? Insurance companies mean somebody else pays the bill. And then nobody cares what things cost. You're a doctor. Do your patients ever ask
Well, very few, because if they're covered under Medicare or under their insurance, they're less concerned than when they're spending their own money. And as a surgeon, I remember a New Year's Eve where I did 8 operations on people who had met their deductibles for the year, but needed their operation done before the end of the year, which of course was New Year's Eve. They got their free operation, because if they waited till after January 1st, it was going to be more money out of their own pocket. So we need to, I believe, get people with
I should
skin
make
in the
it clear
game.
to the audience that he's an orthopedic surgeon, and their surgeries were kind of optional as far as the timing. And you brought this up in that big White House meeting with President Obama.
Well, I talked to the president about having people have skin in the game, that, you know, if we had catastrophic coverage for people so they don't lose their house, but if they sprain their ankle or, you know, have a sore throat, people would do much better as shoppers focused on their own money when it's their money instead of Medicare money or government money or insurance company money. Nobody spends that money as wisely as they do their own.
So do you get the feeling that people are waking up to this, or that even President Obama is waking up to this?
I'm not sure.
Talking to you, was he nice to you in that meeting?
Well, he's always polite, but I think he doesn't fundamentally understand how health care works in America from the standpoint of people are concerned. They want the care that they need from the doctor that they want at a price they can afford. And this health care law, I think, is going to make it worse.
Well, that's bad news, but a market works better for everything else, and if we can just get people to pay more of their own bills. But I would think that the left would say to you, that's cruel, Senator. You're a rich doctor, but what about these poor people? They can't afford this.
You know, they've changed the whole health care system because we had, in this country, of a certain number of people who we could do much better to help. But you don't need to destroy what has worked for so long in a way to try to help them. There are much better ways to do it.
Just one last question. As a doctor and a senator, I assume makes you somewhat unusual, but nobody goes to Tom Coburn, I assume, in the Senate and asks him for medical information. He's an obstetrician, but you're an orthopedist. So they asking you questions?
Every day, including one of my first days in the Senate, John Warner, the senator from the time from Virginia, said, Senator, I need to talk to you about something very important. I said, wow, this is exciting. You know, this is Senator John Warner. He said, sit next to me in the Senate. I went over and sat down. I said, yes, Senator Warner, what is it? He said, it's my left knee. And continue to get folks who need orthopedic advice, and I'm happy to provide.
And he brought his MRI to the gym with him?
He actually had, he had a disc of his MRI, and I was happy to look at it with him.
On that note, thank you very much, Senator John Barrasso from Wyoming. Up next.